Hello students, this is chapter 4.4. In this presentation, I will cover somatic symptom and related disorders. Under this topic, there is somatic symptom disorder, illness anxiety disorder, and convergent disorders. Next, there is dissociative disorders, under which falls dissociative amnesia, dissociative identity disorder, and depersonalization and derealization disorder. Somatic symptom and related disorders. Soma means body, so bodily related symptoms and disorders associated with psychological difficulties. So somatic symptoms, these are the conditions in which there are physical symptoms in the absence of a physical disease. And in this disorders, the individual has psychological difficulties and complains of physical symptoms for which in general there is no biological cause. The people who are suffering from somatic disorders, somatic symptoms, they often complain that there are certain kind of difficulties with their normal functioning, and they often visit doctors for checkup. But they even tell the doctor that they have certain difficulty with certain things. But when the doctor tests them, there is physical examination done. In the report, there is no such thing. That's the reason why there is no biological cause behind this. So the somatic symptoms include conversion disorders, somatic symptom disorder, and illness anxiety disorder, among others. Let's discuss this one by one. Somatic symptom disorder. Somatic symptom disorder, it involves a person having persistent body-related symptoms which may or may not be related to any serious medical condition. They are always preoccupied with the thought that there is this physical symptoms, that is there is pain, there is some kind of headaches, there is some kind of fatigue, there is pain always. So the physical symptoms are not explained because of the physical or mental disorder. Often it can be scientifically proven. Even though the patient feels it, they are not faking it, but in reality, the doctors cannot prove anything. People with this disorder tend to be overly preoccupied with their symptoms, and they continually worry about their health and make frequent visits to doctors, as I already said. And as a result, they experience significant distress and disturbances in their life. In reality, it happens because of the fact that there are some kind of psychological conflicts going on which do not have other way to show, but through through body symptoms, it just shows up. Next, we have illness anxiety disorder. Now tell me, do you know anyone or someone who does these things? They Google every symptom. They worry even after the doctor says they are okay. They make minor illnesses as horrible diseases. They constantly worry about falling sick. They see multiple doctors for the same illness. Why? Because they may have illness anxiety disorder. Illness anxiety disorder, it is also known as hypochondriasis. In clinical terms, it is known as hypochondriasis, which nowadays it is not of much use, hypochondriasis, but instead of hypochondriasis, people now use illness anxiety disorder. Now with illness anxiety disorder, it involves persistent preoccupation about developing a serious illness and constantly worrying about this possibility. Even if a person have cough, cold, fever, forget about that. If a person is consistently coughing for 1 week, the person develops a feeling that he or she might have developed a serious disease, serious horrible disease. If there is a small lump in the body, the person starts uh, starts suspicion that something major is going on in the body, or the person is constantly worrying about falling sick. I hope you all have met such kind of people, yes? So this is accompanied by anxiety about one's health. So individuals with illness anxiety disorder are overly concerned about undiagnosed disease, negative diagnostic results, do not respond to assurance by doctors, even if the doctors say that nothing is there, everything is okay, even then the person is not believing them. They will go on to another doctor. They are never satisfied with one doctor's assurance and are easily alarmed about illness, such as on hearing about someone else's ill health or some such news. They often relate it to themselves. They feel that if they are having, then I also am having the same things. So they get more worried. So they are often worried about his or her own health. Okay. In general, both somatic symptom disorder and illness anxiety disorder are concerned with medical illnesses. But the difference lies in the way this concern is expressed. In the case of somatic symptom disorder, this expression is in terms of physical complaints, while in case of illness anxiety disorder, as the name suggests, it is the anxiety which is the main concern. Next category that we have is conversion disorder. The symptoms of conversion disorders are the reported loss of part or all of some basic body functions. Conversion disorder is a condition wherein the person has physical symptoms of a medical issue but no injury or disease to clarify them. Now, for instance, envision taking a hard fall off your bicycle and afterward not being able to move your arm. Be that as it may, your arm is not harmed, nor is some other part of your body. Your body changed over the intense worry of your fall into the physical reaction of an incapacitated arm. So it may appear to be odd, yet your side effects are real and you cannot control them. Specialists categorize conversion disorder in a more extensive class of diseases, which is called functional neurological issues. So the specific cause of conversion disorder is not entirely known, but some researchers think that conversion disorder is a normal occurrence after physical or mental stressors. Alright, so in other cases, some people do not appear to have a stressor that is causing the effects, and in these cases, the reason for conversion disorder is unknown. Studies into the mechanisms underlying conversion disorder have demonstrated that certain people have increased or decreased blood flow to specific brain regions. Alright, so if regions of the brain that are connected to body parts have decreased blood flow, this may cause neurological issues related to conversion disorder. Now I remember in our life class, you all had a question regarding the relation between like how this blood, this flame, this black bile, yellow bile, it is connected with psychological disorders. Now here I want to bring this focus that with this blood flow there is relation now with conversion disorder. Okay, so it is conceivable that these alterations in blood flow might be brought about by the brain processing data about physical or emotional stressors. So regardless of the reason for the stressors, remember that the symptoms are real. Affected people are not faking the symptoms of the disorder. Alright, so in conversion disorder, oftentimes symptoms reported consist of paralysis, blindness, deafness, and difficulty in walking, and these are the general symptoms. These symptoms often occur after a stressful experience and may be quite sudden. Also, like body tremors, hearing trouble, vision issues, loss of sensation in certain body parts, that is paralysis, and also difficulty swallowing. There is lethargy. Alright? Conversion disorder can occur as persistent or in the form of an acute episode as well. It is ordinarily analyzed as by a neurologist or a psychological counselor. So they may perform a physical assessment as well as a mental assessment to decide if the person meet the diagnostic criteria. Okay. Next up, we have dissociative disorders. The term dissociative refers to a disconnection from one's life, including memories, thoughts, actions, identity, and surroundings. Dissociation involves feelings of unreality, estrangement, depersonalization, and sometimes a loss or shift of identity. People suffering from dissociative mental disorders experience a disconnection from the above mentioned areas in their lives as and lack a sense of continuity. So those who have a dissociative disorder will escape their reality through a number of unhealthy and involuntary ways, which often results in several issues in functioning in their everyday life. When the sufferer is going through stressful situations in their life, this can often make their symptoms progressively worse and more evident to those around them. In total, there are three main dissociative disorders that have been defined by the American Psychiatric Association and published and defined by the organization in the DSM-5, that is Diagnostic and Statistical Manual of Mental Disorders 5. So these are dissociative amnesia, dissociative identity disorder, and depersonalization, derealization disorder, which we will go through one by one. The first disorder under dissociative disorder is the dissociative amnesia. So, dissociative amnesia, it is a condition which involves memory loss that is far more severe and evident than everyday forgetfulness. Alright? So, it is characterized by extensive but selective memory loss that has no known organic cause. Organic cause, that means there is no head injury. So some people cannot remember anything about their past, and others can no longer recall specific events, people, places, or objects, while their memory for other events remains intact. Very strange. So this memory loss cannot be justified or explained by an underlying medical condition. The person is unable to recall information about themselves, events, or people in their lives, particularly if these memories took place during a traumatic time. Dissociative amnesia may occur during specific events at a certain time. For example, intense combat or witnessing a murder. In some cases, the patient may lose all memory of who they are. And this condition is often associated with traveling away from one's life or wandering away in a confused state. This is known as dissociative fugue. The term fugue refers to a period in which a person who suffers from memory loss will sometimes begin a new life and not remember anything from their amnesic episodes of amnesia, will often occur suddenly without warning and are able to last anywhere between a few minutes to even hours. And in rarer instances, the patient may suffer from amnesia that lasts for a few months or years. Oftentimes, when there is some stressful events, if a person is in lots of debt, so at that time also what happens is that many times you will find that people shift from one place to another, and they just don't want to remember whatever happened, the past memories, they just erase it. They, even if not intentionally, but somewhat they don't want to remember whatever the stressful event was. Alright. With this dissociative fugue, the essential feature of this could be an unexpected travel away from home and workplace, and the assumption of a new identity, inability to recall the previous identity, just what I said, and the fugue usually ends when the person suddenly wakes up with no memory of the events that occurred during the fugue, during that stressful event. So this disorder is often associated with an overwhelming stress, as I said. Next, we have dissociative identity disorder, also known as DID. This disorder, as previously mentioned, is characterized by the patient switching between different personalities or alternate identities. Dissociative identity disorder, it is often referred to as multiple personality disorder, the most dramatic of the dissociative disorders. Okay, it is often associated with traumatic experiences in childhood, and in this disorder, the person assumes alternate personalities that may or may not be aware of each other. So the patient often feels possessed by these alters, with each one having their own gender, characteristics, and unique identity. So those with this condition may also suffer from dissociative amnesia and dissociative fugue. People who are suffering with dissociative identity disorder, they have a very difficult life because of multiple personality disorder. Many times they are aware of it, but they cannot help it. Even there are, in some people, there may be 12 persons in one person, 12 personalities. Okay. Next, depersonalization, derealization disorder. Depersonalization and derealization disorder, it is often used interchangeably. But in reality, if we have to tell it in separate ways, depersonalization is a condition that consists of an episodic or ongoing sense of dissociation or detachment from oneself. The affected individual often feels as though they are observing their feelings, thoughts, actions, and themselves from outside of their own body, as though they were watching someone else operate inside of their body or watching a film of themselves. So this condition is often described as an out-of-body experience and is accompanied by the affected person not being able to recognize themselves in the mirror. So often their memories are distorted, and also their emotions are not intact. They lack certain emotional feelings, and there is detachment. There is this string attached with that emotions, where with depersonalization the string has been cut with that of the person with the emotions. Okay. And with derealization, when we say derealization, the things and people around the person may feel dreamlike, foggy, or detached. Time may appear to slow down or speed up. The world may even feel unreal. This is known as derealization. With derealization, objects may also change color or shape, and the environment feels unreal to the affected person. The sufferer may experience either one of these conditions, that is depersonalization or derealization, or both at the same time. So the symptoms which I just said can put the patient in a state of distress and can last for a few moments or for a number of years. To simply explain the difference between the mentioned conditions, depersonalization refers to feeling detached from oneself, feeling as though the individual is seeing him or herself through someone else's eyes. Alright. And derealization refers to seeing one's environment in a distorted way that appears unreal and dreamlike. Now students, in this slide I have attached a video in order for you people to understand depersonalization and derealization in a better way. So please go through this video. If you click on the video, it will play. So check this out once. I hope you like it and also better understand it. Okay, I'll just show it once.
Depersonalization versus derealization. Have you ever felt detached from the world or felt like you don't belong in your own body when you look down at your hands? Depersonalization and derealization is a psychological disorder in which this experience is intense and prolonged. About 50% of the general population have come across at least one of these experiences in their lifetime, but only roughly 2% are actually diagnosed with the disorder. It occurs equally in men and women and can start as early as one's early or middle years. But the two terms, depersonalization and derealization, are often mixed up and misunderstood, even though they're often grouped together. So what's the difference? Depersonalization is when you feel cut off from yourself, when you feel like a robot or like you're not in control of your own movements. You're experiencing depersonalization. People with depersonalization disorder don't feel like themselves and struggle with feeling in tune with their emotions. These patients may feel like they're an outside observer of their own lives. They feel disconnected from their memories and may not remember them clearly. Most of the time, they have out-of-body experiences because they don't feel grounded in their own bodies. Symptoms of out-of-body experiences include hearing undefined sounds, such as a train going by or soft murmurs, and feeling like you're sinking into a bed while your body feels numb and out of control. Derealization is when you feel cut off from the world. Patients who experience symptoms of derealization feel as if they're in a dream or as if there's a glass wall or veil that's separating them from their surroundings. The world feels funny and distorted. Objects around them can feel and appear smaller or larger than they actually are. Surroundings may also be blurry or unusually clear. Sounds can seem louder and more overwhelming, and time can feel like it's slowing down or going too fast.
Alright, so this was the video talking about depersonalization and derealization. Now with this, I end today's presentation. So in today's presentation, I have covered somatic symptoms and related disorders, dissociative disorders. Please go through the presentation once again and try to understand. Thank you.